real talk about heart valve failure.
You know, one of the things I've noticed as a cardiologist is how equal opportunity aortic valve disease is. And, you know, it afflicts all of us, no matter your race, your ethnicity, especially as you get older. Once symptoms start, up to 50% of patients die within 2 years without treatment.
So time is of the essence, and it's important to have early intervention, especially if you're symptomatic.
Patients can get diagnosed accurately, they can get treated, and they can feel better, live longer, and live better.
I see patients brushing off how they're feeling. They chalk it up to just their age catching up to them.
You truly have to build a good relationship with your doctor. I've always felt my doctor and I became partners in my health. And although I know he's got 100 and something patients, he had a way of making me feel that he was just concentrating on me.
And I think that comes with trusting your provider, with having a trusting relationship and being transparent on, both sides. And just knowing that you just have to be attentive and listen, because a lot of times we do all the talking, but you really have to be attentive to pick up on some of the clues and the signs, even if they're not real transparent with you.
Yeah, it's important for patients to know how to advocate for themselves. So when you're in that doctor's office, ask the questions, answer the questions that you're asked honestly, and don't sweep things under the carpet. Patients need to be given more information about treatment. There are other options beyond open heart surgery.
That's very important.
And just making sure as a patient, when the treatment options are presented to you, that you ask the appropriate questions.
People need to know that the treatments for heart valve failure can make a significant difference in their daily lives.
For me, I want my heart valve failure patients to get to the heart team as soon as possible.
Collaboration is
Right.
definitely the key when you have multiple providers and specialties involved in the continuity of the care of the patient.
Having knowledge of their treatment options can help change their mindset, letting fear lead to avoidance. There needs to be more education around what happens if they do nothing.
With heart valve failure, waiting is not winning. That's why it's important to intervene as soon as possible.